Along with illness disclosure, an important aspect of determining treatment strategies is informed consent. Informed consent refers to consent obtained to undergo tests or treatment after the patient has received a sufficient explanation from medical practitioners. In the past, the mainstream view was that if you came to the hospital, you would leave everything up to the physician. But now, with an increased awareness of patient rights, there is more respect for the patient's right to self-determination. So the patient receives an explanation about the advantages and disadvantages of various treatments and then decides on their own. By the way, informed consent is often abbreviated as IC in Japan. So doctors and nurses say, get the IC from the patient, in a way that stresses the medical practitioner's perspective. But it is necessary to note that originally this was an idea that stressed the patient's viewpoint and active consent. Today, with emphasis on patient-centered medicine, disclosure of the illness and informed consent are becoming standard practice, and this trend is likely to continue. What is important in these situations is ensuring adequate communication between the patient and medical practitioners, such as physicians and nurses. If explanations are given without considering the patient's capacity to comprehend them, or what the patient desires to know, this does not necessarily mean that the patient's right to self-determination has been respected. On the contrary, such actions can confuse or even harm the patient. For example, if a patient is informed that they have cancer over the phone or in writing, or suddenly were told they have 3 months to live, before even building a relationship of trust with the physician, the patient might experience disappointment, anger, or alienation. It is also necessary for patients to give regular thought to what they do or do not want to know about their illness, and explain this to the physicians. It is particularly important for patients to talk frequently to their families about their thoughts on terminal care, and explain whether they would want to know if they developed cancer. One cancer-themed film that depicts life after cancer disclosure is Akira Kurosawa's Ikiru. Ikiru means to live in Japanese. You may enjoy watching this film. Thank you for watching. See you next time.